Hello friends, today we are going to discuss about medical negligence. I am Dr. Suresh, Professor of Psychiatry, working at NIMANS, Bangalore. I have done my PhD in Law from National Law School, Bangalore. Before I start my presentation, I would like to have a disclaimer. This presentation is for academic and training purpose only. If you want to have a legal opinion, please do contact an advocate. Conflict of interest? None. In this video, I am not going to discuss about the individual legislation such as Mental Health Care Act, Right to Persons with Disability Act, Medical Termination of Pregnancy, PNDT Act, POXO Act. Individual legislation I am not going to discuss. We will be discussing mainly on medical negligence. So objective of this video is, can doctors allowed to do mistakes or errors as with regard to investigation, diagnosis and management? If he is not allowed to do mistakes, whether those mistakes can be constituted as a medical negligence? What does not constitute as a medical negligence? And also, what are the due process of law to be followed to prove whether a person is medically negligent or not? So these are the important questions I am going to answer in this video. This video is essential for doctors, advocates, and also patients and their family members. I am going to discuss this into 6 important categories. First and the foremost, Bolam test, Bolito test, clinical practice guideline, medical negligence. In that I'll be discussing criminal negligence and also civil medical negligence. Let's move into Bolam test. See, in 1957, a landmark decision was taken in UK, that is Bolam test. Before this test, there was no majorly important documented case law with regard to medical negligence. Let's discuss about this Bolam. This is a very important celebrity case which has been accepted across the world, including India. This case is called as Bolam versus Friar Hospital Management. This was decided in 1957. Mr. Bolam is a voluntary patient who used to suffer from recurrent depressive disorder. In one of the episodes, he becomes extremely depressed and thinks of committing suicide. Hence, he approaches this hospital, Friar Hospital, and he requests for treatment. So, they decide to give him electroconvulsive therapy, widely known as shock treatment. They decided, and Bolam receives the electroconvulsive therapy. Invariably, ECT is given in 7 to 10 sittings on alternative days over a period of 2 to 3 weeks. In the first 2 to 3 electroconvulsive therapy, he does not have anything. And in the third, because of the electroconvulsive therapy, whenever you give electroconvulsive therapy, the person develops seizure. See, ECT was started with the premise thinking that psychosis and seizure do not coexist. If you induce seizure by any means, the psychosis will go away. So in 1930, it started with like injection of camphor, various other things. Later, we graduated to give electroconvulsive therapy to induce seizure. Here, in one of the seizure, when it was induced by electroconvulsive therapy, he developed acetabular fracture. And this caused anguish in Bolam. He improved with the depression completely, but he was very unhappy because he developed acetabular fracture. Since he has developed acetabular fracture, he goes to the court and say that I had gone to the Friar Hospital for depression treatment and they have fractured my acetabular. And he says, I need to be given compensation. So here, the court, which was presided by Judge McNair, was in complete shock, telling that how can a patient sue the hospital? There was no such case earlier in UK. They tried to look into various other countries. There was no such hospital being sued or the doctor has been sued. In this case, Judge McNair thought for a while and said, let's call the experts. So remember, this is during 1955 or 56. So there were experts. One group of experts said that when we give ECT, we give muscle relaxant, we give anesthesia, and we do hold the patient so that there is no fracture. That is one group. The other group of psychiatrists said that, sir, if you give anesthesia or muscle relaxant, it causes sometimes unfavorable outcome, like patient may die because of anesthesia. Imagine, I'm talking about 1955. So anesthetic agents were introduced during that time. So many psychiatrists were not comfortable. So there were 50% following the unmodified electroconvulsive that is without anesthesia. Another one is with anesthesia and muscle relaxant. So now the Judge McNair was completely again in a kind of confusion what to do. How to decide this case? Think about for a minute. If you are a Judge McNair in 1955 or 56 and you have to decide this case, a patient who has gone for depression treatment has received a stapler fracture. Let me remind you, during 1956, the informed consent norm was not there also. So the issue of discussion whether the patient was informed consent was taken doesn't arise. The informed consent arose later, that is 1972-73 after the Belmont report. I'm talking about 1956. So in such a scenario, Judge McNair gave a landmark decision. And that is, the decision still now exists. Judge McNair clearly said, a doctor is not guilty of negligence if he has acted in accordance with the practice accepted as a proper by a responsible body of medical men skilled in that particular area. That means, during 1956, the psychiatrist followed two types of practice, and the psychiatrist is able to follow one of them. That means he is not negligent. So Freiherr Hospital was allowed to walk away, and the Bolam was said, sorry, the hospital or the doctor did not err. And this landmark judgment played a very crucial role over a subsequent of years. And also, the Judge McNair clearly said that if a doctor reaches the standard of responsible body of medical opinion, he is not negligent. That means all of us need to follow certain standard reasonable practices. And if you are able to follow your professional norms and clinical standard practice guideline, you are not negligent. Failure to use such a reasonable, prudent and careful person would have used under similar circumstances would constitute to medical negligence was also defined. That means if the doctor falls below the standard of the medical practitioners prevalent at that time, then the doctor will be negligent. The Bolam test is basically a peer review test. That means if your action is questioned in the court of law, your colleagues, that is basically will be called as expert, and they are going to review whether your action was negligent or it is not negligent. So this is a very important acid test which was introduced in 1957, and till date it is used in various parts of the country and also various parts of the globe. So this peer review test went into criticism. Many judges, lawyers, patients and family members started to criticize how can a doctor need to be assessed by another doctor. That means we will not accept that peer review. This was the question which has been raised very often by various advocates. And hence, there has been various tests have been proclaimed. And we will be discussing about that. And here, the very clear important message driven during the Bolam test is that he has to meet the reasonable degree of practice. One, and the doctor must demonstrate that he has acted in a manner in which a responsible body of medical professional who work in the same field would deem that it was a reasonably appropriate. This was a clear-cut peer review based. The criticism was, as I said, it was not accepted by the advocates, judges and many of the civil society members. To summarize, my dear friends, Bolam test, if you fail to match the required standard of care, you will be considered as negligent. A peer-reviewed test, hence it has been criticized. How can a doctor will assess another doctor was the question. So with this, the Bolam test has been considered. Now we will move into an important concept of Bolitho test. What is Bolitho test? Let's discuss about this Bolitho Patrick test. In this Bolitho test, a young 2-year-old child is suffering from cold and cough and is admitted in St. Bartholomew's Hospital ICU. And in the ICU, once Patrick Bolitho developed severe cough. The cough was so severe, he used to go into hypoxia. And he developed cyanosis. The ICU nurse called the doctor who is on duty, that is Dr. Horn and Dr. Roger. Because they were in casualty, before they could arrive to the ICU, the child recovered. The nurse called the doctor and said, "Sir, no need to come. The child has recovered." Similarly, 2 more episodes occurred and the child recovered before the doctor came in. But in the 3rd episode, the child went into a severe cough and hypoxic injury of the brain occurred before the Dr. Horn and Roger could come into the ICU. By the time they arrived to the ICU, the child was already cyanosed. Somehow they were able to revive the child. But after a few days, the Patrick died. The parents were very unhappy. They went to the court telling that Dr. Horn and Roger were negligent. And this case was again discussed in the court of law. In the court of law, again, the judge did not know what to do. He called the experts. One group of experts said that in such a scenario where a child is admitted in ICU and with a severe cough, if the child goes into cyanosis, I will do intubation and I will give oxygen. That was one group of pediatricians said. But the another group of pediatrician, they said that, "Sir, if the child is severely coughing and there is already laryngeal spasm is there, I will never ever do intubation. Maximum is I will give just an oxygen." Now the judge was very confused what to do. And he applied something called as Patrick-Cobolic test. This is a very important test. The reason being is, if you consider the 2 groups of experts, one will do intubation, another will not do intubation. So here, both the Horn and Roger were not negligent as per Bolam test. But the court took the contrary. It said 3 times the ICU doctors were called from the duty. In all the 3 times, they came late. They did not attend the patient early. On that basis, Patrick-Cobolic test upheld and Bolam test was said that since the expert body of opinion did not logically supported their decision, hence Bolam test was squashed. And they said Bolitho test will be upheld. According to summarizing this Bolitho Patrick test, if you are giving a Bolam test and you are giving expert opinion, and that expert opinion should have a logical explanation, and also it should convey the message to the court that the doctors acted not only in a reasonable degree of care, but the logical analysis has to be applied, telling that the doctor played his role. That is Patrick-Cobolic test. That means Bolam is standard of care. Bolito test is you have to convince the court that the expert opinion is based on logical analysis. Along with this, there is another very important Montgomery versus Lancashire Health Board test that came in 2015. This is again one more landmark decision which has occurred. In this Montgomery versus Lancashire Health Board test, a lady with a short stature having diabetes becomes pregnant. She goes for antenatal checkup. In all the antenatal checkup, The obstetrician says that you will have a good child, you will have a normal pregnancy and normal labor. And she goes into the labor. And during the labor, the child gets stuck. And with the difficulty, they were able to take the child out, but unfortunately, the child developed shoulder dystocia and also cerebral palsy. Now, once the mother comes to know that her child has now shoulder dystocia along with cerebral palsy, she approaches the court telling that the doctor never explained me that if a mother is diabetic, short-statured, that means they should have explained me and offered cesarean section. They never did that. And she asked for compensation for a disabled child because the child is having cerebral palsy. What did the court do here? The court, in this case, came up with a landmark decision telling that every patient clearly said that the court's growing appreciation of patients' self-determination and the ability to understand the consequences and the risk of a particular treatment should be explained to the patient. That means the court clearly said that patient has self-determination power, that is right to self-determination is there, and the doctor should give complete information in the language what the patient can understand, and the patient should be enabled to take his own decision. Without giving information, you cannot just consider informed consent. In this case, the doctor and the hospital were held negligent. And here also, very clearly, in both the Bolam test, Cobolic test, and also here in this Montgomery versus this case, the court was very clear that there should be a standard of care, it should be logical explanation, and right to self-determination with regard to informed consent should be upheld. That was the very important decisions, 3 important decisions with regard to medical negligence was conveyed to the medical fraternity. Coming to the third important concept, discussing about clinical practice guideline. Whether we should follow this clinical practice guideline is a big question. In a very important case, Maharaja Agrasena Hospital versus Master R. This occurred recently in 2019. In 2005, Master R was born at 32 weeks. Because of placenta previa, in the Sharma Medical Diagnostic Center, Dr. Rama Sharma takes the child and the child was born. Since the child was only 1.49 kg, it was premature baby and it was critically ill. Hence, Rama Sharma referred the case to Maharaja Agrasena Hospital. In this hospital, the child was kept in the neonatal care. In the neonatal ICU, the child gained all the weight, improved, and the child was discharged. Subsequently, the child came 4 times for follow-up. In the 4 times, retinal examination was not done. In 2015, mother noticed the child is not responding to the light or else to the visual stimuli. She takes the child to Rama Sharma. Rama Sharma said that please go to Agrasena Hospital because the child has some eye problem. Hence, again, the lady takes the child to the Shah of Charity Eye Clinic and they found that the child has developed retinopathy of prematurity, that is ROP, and it is in stage 5, nothing can be done. Retinal detachment has occurred. Hence, they said the child has lost both the eyes. Now, the mother of the child is very unhappy and she approaches the Maharaja Agrasena Hospital, asks for medical record. Unfortunately, medical records were not divulged to the mother. She had to go to the Delhi Medical Council to get the records. Once she got the records, she approached the court. In this landmark decision, Supreme Court was very clear. And it clearly examined the whole medical records and an opinion taken from All India Institute of Medical Science, New Delhi. And they clearly said that there was no notes in the follow-up asking for retinal examination either by the Maharaja Agrasena Hospital or else by Dr. Rama, and clearly said that the doctors were negligent and ROP could have been easily prevented by just a retinal examination and doing certain intervention. And the court, Supreme Court, clearly said that the hospital should pay 75 lakh as a compensation to the child, with the child has now lifelong disability. And hence, my dear friend, it is very essential to follow clinical practice guideline. Clinical practice guideline is not just an academic exercise. It is a clinical exercise. If a guideline have been produced by a respected body, like any professional body, maybe psychiatrist, maybe having Indian Psychiatric Society, Indian Physician Society, or else Gynecological Association, if they have come up with a clear-cut guidelines, you need to follow. And that guideline has been accepted by the professional body, and there should be a strong reason for not to follow the clinical guidelines. Please do remember, there have been n number of cases. Even a similar case has occurred in Krishna Kumari versus State of Tamil Nadu. This was a judgment in 2009. Again, here, a young child was born. That child had again retinal ROP was developed, and the doctor did not even bother to do the retinal examination. In such a scenario, even in that court, Supreme Court was very clearly said that the pediatrician did not follow the guideline. And in that case also, heavy fine was paid and the compensation was paid to the child. To summarize, my dear friends, please do follow clinical practice guideline. And not only that, you need to have a good prescription. And in the prescription, you should have your name, your specialty, your registration number, and also regular follow-up date has to be mentioned. Please do mention whenever there is a side effect, please stop the medication and approach the nearest doctor or else come to the hospital emergency. Ask for supervised medication. Give advice for walking, diet, exercise, yoga, and any other special procedures, like if you want to request the family to do any investigation need to be written. And that is very essential. Coming to the fourth important aspect I am discussing now, coming to the medical negligence. See, I have discussed four important things. One is Bolam test, Bolito test, clinical practice guideline, and also the informed consent need to be taken. So these are the four important I have discussed. Now we will go into the medical negligence. My dear friend, to consider a medical negligence, the medical profession is considered as a profession. So the professional negligence will be considered here under the tort law. Under the tort, it is very clearly three important criteria has to be taken. First and the foremost, there should be a relationship between the doctor and the patient. That relationship owes a duty of care. That is one. That is duty of care. And then in the second, there should be breach in the duty of care. That is act of omission or a commission by the profession which leads to damage. That means third one is because of the breach in the duty of care, there is a damage. And the damage should be clearly foreseeable. It should not be remote. And that harm should be compensated. So these are the three important medical negligence test has been put forward by under the tort law. Three are basically: first, duty of care; second, breach of duty which the doctor has owed to the patient; third, because of that breach, there is a direct damage, not a remote, direct damage to the patient which has to be compensated. See, the third point is very, what we call it as difficult to understand. What is that remote? It should be direct. That means, imagine if you have given a paracetamol to a patient because he had come with a history of fever. Now the patient takes paracetamol tablet, he starts walking on the road and he tumbles and falls in front of a lorry, and the lorry passes over him and the patient dies. Now, the advocate can argue in two ways. First one, the doctor gave a medicine. That medicine caused him giddiness and which was not explained to the patient. Hence, the patient had a giddiness, fell down in front of a lorry, and the lorry passed over him. This is one. Second one, no sir, it is nothing to do with paracetamol. The patient tripped over and fall down, and because of his falling in front of a lorry, the patient met with an accident. So there are two issues here. So whether paracetamol caused dizziness, which is remote. That means dizziness is not a side effect of paracetamol. So that remote will not be considered here. It should be a direct effect of the medication or the action of the medical practitioner. So that is direct effect, not a remote effect is considered. Duty of care. How to establish this? So these each 3 points has to be proved in the court of law by the patient. The doctor has to rebuttal for each of the information what the patient provides. Let's understand about what is duty of care. Duty of care is the patient enters into the hospital to take treatment. As soon as he opens the slip, OPD slips, or else meets the doctor and the doctor says, listens to him and he gives a prescription. The duty of care exists now. That means providing receipt or a prescription, the duty of care has existed. This duty of care, again, let me be very clear. Duty of care is there whenever the doctor accepts to treat him. The doctor can refuse to treat him in certain situation, but this is not allowed in emergency care. In casualty, none of the doctor can refuse the patient. He has to provide care. It can be even first aid, counseling, giving a referral, making arrangement of an ambulance, shifting the patient to the higher center. So those need to be done by the doctor. He cannot just wash his hand during emergency. And this came with an important case with Paramanand Kataria versus Union of India in 1989. This is a landmark case, Paramanand Kataria. In this Paramanand Kataria versus Union of India, a social worker is walking on the road and he sees a motor vehicle knocks down a scooter, who is a person who is riding a scooter. The scooter rider falls down, sustains a head injury. This social worker runs towards him, but by the time the motor vehicle takes the vehicle and goes off very fast. This pedestrian is picked up by the social worker. He takes him to one hospital. That hospital said, no, this is a police case, we cannot treat him. He goes to the next hospital. They also say that, no, it is a police case, we cannot treat him. By that he reached the third hospital, the patient died. The social worker was very upset. He writes to the Supreme Court of India telling that what kind of law is this, which comes in the way of right to life under Article 21. The Supreme Court took this case, and then in that case it clearly said that Paramanand Kataria versus Union of India, the doctor do not have the choice of patient, he has to provide treatment. And this was brought from the Hippocratic Oath, where the doctor has said that I will provide care for the patient who is in need. And now emergency care is in need. And this has now become a case law. So my dear friend, if a patient is in emergency, maybe catatonia, maybe drug withdrawal, maybe suicidal attempt, please don't refuse to treat them. Provide a first aid, provide referral, counsel the patient and the family member if you are unable to treat them, and refer the patient. That is duty of care. Now, the breach of duty. That is the second point we are discussing. The breach of duty is basically act of commission or omission. The act of omission is not doing something which a doctor was supposed to do. Act of commission, doing something which the doctor is not supposed to do. So the act of commission omission, which is not ordinarily done by a reasonable doctor, that is considered as a definitely breach of duty. Now, let's understand this. If the doctor leaves a scissor inside the abdomen of the patient, here the doctor will be considered as directly negligent. This is an act of commission. He is not supposed to leave the scissor. You have to check the abdomen before closing it. So the negligence is act of commission. Suppose if his act of omission is there, Before giving a penicillin injection, the doctor and the nurse should give a test dose. If they don't do the test dose and they give an injection and the patient goes into a hypersensitivity reaction, act of omission will be considered, because no reasonably prudent doctor will give injection penicillin without test dose. And in both the case, it will be considered as breach of duty either by the act of omission or commission. Foreseeability of the event is very essential. That means the doctor should be able to foresee, if I give this medicine, there will be these side effects, and that side effects need to be told to the patient, and the patient consent has to be taken. And not only that, the chain of events which leads to the damage to the patient should be a clear-cut link. There should not be any missing link. If the missing link is there, then the avoiding of compensation will be very less. That means there is a duty of care, there is a breach in the duty of care. Because of breach, there is a damage. All these three important things need to be proved in the court of law. Then only the compensation will be awarded by the court. And my dear friends, duty of care to the patient or patient family member, this is another important question. Should we consider patient as primary, or else the family member is a primary? This is a question very often asked by many of my clients and many doctors. We ask this: do we owe duty to the patient or the family members or to the society at large? This is a question which needs to be answered case by case. Today I am going to discuss a very landmark article which was presented in Lancet in 2020 March, exactly 1 year back. This is an interesting case. In this case, Mr. X, he shoots his wife and kills in 2007. He is a person who is very short-tempered. He used to take alcohol, and in one of the fight, he becomes extremely short-tempered and he shoots his wife. Now, Mr. X is arrested. And during the trial, he says, I have a diminished responsibility because I am a short-tempered guy, I am mentally ill. The court says that, okay, he was using alcohol. Under diminished responsibility, they will consider it as manslaughter. And during the imprisonment, in the prison, he has a child also. The child is now adult. And she gets married also when the father is in the jail. And inside the prison, this Mr. X develops abnormal movements. He is diagnosed as Huntington's disease. The doctors inside the hospital said, Mr. X, you need to tell this to your daughter. She has a high chance of developing Huntington's disease. Mr. X refused to give consent to inform his daughter. And since he has not given consent, the doctors do not inform the daughter. The daughter gets married, she becomes pregnant, and she even delivers a child. Subsequently, when she visited her father, in 2013, she comes to know that her father has developed Huntington's disease. And this is a genetic disease. And there is high chances she would have been carrying the gene, and her child is also highly chances that the child also may develop Huntington's disease. And this is the way it gets transmitted. You look at this. Huntington gene is in the chromosome 4, and here CAG repeat occurs. Because of the CAG repeat, the Huntington gene produces the Huntington's protein, and subsequently causes neuronal toxicity, and which causes Huntington disease with abnormal movements, with sometimes mental illness, that is, and also early death. Now, in this scenario, 50% of the family members are carrying the gene. In this Huntington's disease, it is autosomal dominant pattern of transmission. The lady becomes very upset. The doctor did not tell me. And she undergoes testing. And unfortunately, the test clearly results said that she is also carrying a gene. There is high possibility she may develop the illness, and also her child. Now she goes to the court. telling that the doctor withholded the information which I am also affected and my child also is affected. If they had told me, I would have taken necessary precaution. I would have got the genetic testing done. And the court, what it said is a very essential discussion. My dear friend, this was the recent discussion which has occurred. And the court decision was very clear. Court refused to accept her claim that assessment and information to the family members has to be given. The court was very clear. The doctors owed responsibility to the patient, not to the family members. This is a landmark decision, but however, the court also said the doctor should need to consider the risk versus benefit informing the family members. But in this case, the daughter was refused to get the compensation. Summarizing, my dear friends, every doctor has a duty to act with a reasonable degree of care and skill. Negligence is the breach of that legal duty of care. Not only that, the practitioner must bring to his task a reasonable degree of skill and knowledge, neither the very highest practice of care nor the lowest. It is the reasonable degree of the care which is required, and that the law expects that. Suppose you are practicing in one of the district like Mangalore. The law will not expect you to provide a care at the level of the Nimans or not at the level of wellness center or at the PHC level. You have to provide the care of the district place. So that is what the court is mentioning in this discussion. Summarizing again the medical negligence. In this medical negligence, simple negligence can cause action of will be civil negligence, and the doctor can be sued in the court of law, either in the consumer court or in the civil court. If the negligence is very gross, that means the doctor's action was very reckless. In such a scenario, it may invite criminal liability. That means arrest of the doctor. Let's discuss about both criminal negligence and also civil negligence. Now, first we discuss about criminal negligence. In criminal negligence, the doctor can be booked under section 304A. It clearly in 304A, it says that causing death of any person by doing any rash or negligent act which does not amount to culpable homicide. This is nothing to do with only doctor. Any professional negligence causing death of a person which not amounts to culpable homicide can be booked under 304A. But however, there is something called a section IPC 336. Here, rash and negligent act endangering a human life. That means the behavior of the doctor as a professional puts somebody under danger. That is endangering the life. That is 336. Under Indian Penal Code 337 section, it clearly says causing hurt to any person by doing any rash and negligent act that would endanger human life subsequently. Here, there is an injury. Coming to section 338, causing a grievous hurt to any person by doing a rash and negligent act. So we are talking about death under 304A, putting somebody's life endangered, that is 336, causing a simple injury, that is section 337, a grievous injury under 338. Let's discuss the two landmark discussion which has occurred in the Supreme Court. The first one is Suresh Gupta versus Government of NCT, Delhi, which was decided in 2004. Subsequently, Jacob Matthew versus State of Punjab in 2005. These both are very important landmark case with regard to criminal negligence. I would urge every doctor in India need to read this landmark judgment. Let's discuss the first, Suresh Gupta versus Government of NCT. In Suresh Gupta versus Government of NCT, a young boy comes for treatment. Basically, this was an elective surgery which was planned for a deviated nasal septum. So he walks into the hospital. Surgery is planned for DNS. He signs the consent form, goes into the surgery, and in the OT theatre, anesthesia has been initiated. Now, the surgeon, who is a ENT surgeon, Dr. Suresh Gupta, searches for the endotracheal tube. Unfortunately, on that day, there was no endotracheal cuffed tube was there. Hence, Dr. Suresh Gupta goes ahead without cuffed endotracheal tube. Surgery is done, but the patient died. Here, because of the surgery, the blood started seeping in, and since there was no cuffed endotracheal tube, the blood clot blocked completely the endotracheal tube. The patient died. Here, the patient's family member went to the court telling that Dr. Suresh Gupta was grossly negligent, and they gave a complaint to the police. Dr. Suresh Gupta was arrested and he was dragged to the police station, from there to the court. This is Suresh Gupta versus NCT Delhi. Second case, Jacob Matthew versus State of Punjab. Here, one of the senior bureaucrat in Punjab takes his father, who is having cancer, he is in a deathbed, takes to the hospital and requests Jacob Matthew, see sir, my father, he is having cancer, he is in the last days, why don't you provide care? Dr. Jacob Matthew tried to explain to the senior bureaucrat, telling that you need to give care in the home. But however, because the senior bureaucrat is insisting, Jacob Matthew admits the patient. On one fine day morning, early morning around 5 o'clock, 5:30, the bureaucrat's father, that is the patient, goes into gasping. Immediately the sister was informed. Sister calls the duty doctor. The duty doctor comes and they bring in the oxygen cylinder. And they connect the oxygen cylinder and they try to give the oxygen to the patient. Unfortunately, the cylinder is empty. By the time they got the next new cylinder, the patient had died. Now, the senior bureaucrat becomes very angry with the hospital. And again, Dr. Jacob Matthew is arrested and taken to the court. In both the cases, the doctors were considered and the charges were put as criminally negligent. In both the cases, it's not their reasonable care. It is the issue of non-availability of an instrument or non-availability of oxygen. So Jacob Matthew and Suresh Gupta, in both the cases, the Supreme Court gave a landmark judgment with regard to criminal negligence. And in both the cases, the verdict was very beautiful. It clearly said that to establish criminal negligence, there should be culpable gross negligent by the doctor. Just because there is no cuffed endotracheal tube, just because there is no oxygen cylinder, you cannot charge the doctor as negligent. This is a beautiful judgment. And not only that, the court clearly said, don't threaten the doctors unnecessarily. And don't put the doctor into prison. This is not good for the society. And a guideline was clearly documented. And in this, both the cases, Jacob Matthew and also in the Suresh Gupta, the Supreme Court gave a guideline how to proceed before you arrest a doctor. This criminal negligence, if there is a death in your hospital, inform the police, hand over the body to the police and also the medical records. It is the duty of the police officer to subject the body for postmortem, take the medical records, submit to the independent body or else to the state medical council. If the state medical council feels yes, there is a prima facie of medical negligence, FIR can be lodged. As a matter of fact, they are not supposed to arrest the doctor. If they have a doubt the doctor may escape or run away, then only they have to arrest. This is the guideline for criminal negligence. And every doctor should know their rights. At the same time, inform the police about these rights. Doctor cannot be routinely arrested. Coming to the civil negligence, my dear friends, the judiciary has been lenient towards doctor with regard to criminal negligence. But however, when it comes to civil negligence, they come very heavily on doctors. Because of the perception telling that doctors make money, the hospital make money. Hence, there has been various avenues has been kept open to the patients to go for civil cases. various avenues which are civil negligence cases. One is civil court, next one is consumer court. So these two avenues are there. Along with that, the patient and the family members can approach National Medical Commission 2019 Act. Under that, they can approach the commission, or else they can approach Clinical Establishment Act. Under that, there is a board, they can approach that also. Along with that, they can approach various commission like Human Rights Commission, Women's Commission, and Child Commission. Under these various avenues, the patient can give complaint, and the doctor has to answer for his action. Let's take two important civil cases. First one is Kusum Sharma versus Batra Hospital, which was decided in 2012. This is a landmark judgment by the Supreme Court. And the another one is Balram Prasad versus Kunal Shah 2014. This is again one more landmark judgment by the Supreme Court of India, where 11 crore rupees of compensation was given to Kunal Shah and his family against AMRI Hospital and the doctors who treated the Kunal Shah's wife who expired. But in this video, I'm going to discuss about Kusum Sharma versus Batra Hospital. Kusum Sharma's husband, K. Sharma, was working in an Indian Oil Corporation. He is suffering from severe hypertension and also generalized edema of the body. He goes to the nearest hospital. They subject him to various tests. They could not find anything, hence they refer him to the Batra Hospital. In the Batra Hospital, R.K. Sharma sir was subjected to CT scan and ultrasound of abdomen. And in the CT scan and ultrasound, they found 5 into 4 centimeter mass on the left kidney. That was, he had a tumor in the adrenal gland. Hence, he was requested for a surgery. And informed consent was taken. Patient was posted to elective surgery. During the surgery, unfortunately, the pale of pancreas was damaged. Since the pancreas was damaged, they kept a fistula, they kept the tube for drainage, and they closed. Subsequently, second operation was done to close the fistula, and the patient was discharged. Subsequently, the patient had the fistula. Again, there was a drainage. There was no, what we call it as, the closure of the fistula occurred. The patient gets admitted in AIIMS Delhi, and even in AIIMS Delhi, the Department of Gastroenterology do consider him for case conference discussion. After that, the patient wanted to go to his native place. He goes back to Jaipur. Even in MG Jaipur Hospital, he is admitted. All of a sudden, the patient suddenly developed fever, and subsequently he developed pyogenic meningitis and expired. Now, his wife Kusum Sharma goes to the court, telling that the doctors at the Batra Hospital were negligent. And in this landmark decision case, the court gave important points with regard to civil negligence. And in this case, Kusum Sharma versus Batra Hospital, the Supreme Court said following points. First, negligent is the breach of duty exercised by omission to do something which a reasonable man, guided by those considerations which ordinarily regulate the conduct of human affairs, would do, or doing something which a prudent and reasonable man would not do. This clearly said that the reasonable care has to be provided. A reasonable degree of doctor should not do something which he is not supposed to do, or doing something which he is not supposed to do. So that's clearly said that a prudent man test has been brought in here, and the Supreme Court of India has accepted it. And clearly, the Supreme Court also said that medical practitioner would be liable only where his conduct, that is professional conduct, fell below the stand of reasonable competent practitioner in his field. That means if a doctor is working in a district hospital, his skills will be judged equivalent to another district hospital surgeon, not a doctor working in AIIMS. That's the point here they have conveyed. Coming to the third point, the medical profession is expected to bring a reasonable degree of skills and knowledge, and must exercise a reasonable degree of care. Neither the court expects very high degree of care or very low degree of care. It is the reasonable degree of care what the court expects. So my dear friends, so the reasonable degree of care is a similar doctor in your situation, how would you would have treated the patient? That's the question here. Fourth important point. Negligence cannot be attributed to a doctor so long as he has performed his duties with reasonable skill and competence. Merely because the doctor chose one course of action in preference to another one available, he would not be held responsible as negligent. That is basically Bolam's test. That has been accepted here in the Supreme Court decision. Further, Supreme Court was very clear. If there is a genuine difference of opinion with regard to diagnosis, that cannot be held as a negligence. That means, if the patient comes with a fever, you can ask one doctor. He may say it may be typhoid. Another doctor may say it is a viral fever. Third doctor may say it may be a coronavirus infection. Or fifth doctor may say it is a malaria. So, there is a genuine difference of opinion cannot be attributed to negligence. That's what a very important point has been said. Because many a time the patient family member used to go to the court telling that doctor is negligent because for a wrong diagnosis. If there is a difference of opinion with regard to diagnosis, the doctor will not be held responsible as a negligent. Negligence is an essential ingredient of the civil offense. The negligence to be established by the prosecution and should be culpable or gross with regard to criminal negligence. But however, with civil negligence, it is the probability of the civil evidence which is produced. In criminal cases, the evidence produced should be beyond reasonable doubt. That means there should not be any doubt produced by the prosecution against the doctor. But in civil cases, it is the probability of the evidence. Who produces more evidence? Is it the doctor produced more evidence that he is not reasonable degree of skill, he has been able to provide care? Or else the patient's party brings in more evidences telling that the doctor is negligent. That means whoever brings the evidence more in favor of the case goes in. So that means here gross negligence and the evidence beyond reasonable doubt is required for criminal case. For civil case, it is the probability of the evidence which plays a role. So my dear friends, if you know about medical negligence, you should also know about the reducing the potential liability. There are some important tips I am going to provide you now. First, maintain open and honest communication between the patient and the patient family members. If the doctor becomes a patient, and how he needs to be communicated, and how, if you imagine if you are a patient, what the way you need to be treated, the same way you need to treat another patient. That means you should have very good empathy. You should have an open communication with the patient. Keep all communication open, clear and candid, and give time for the patients to discuss. Take informed consent. Informed consent should not be taken in a hurry-burry. It has to be given time. Process has to be documented. Information has to be provided to the patient. Then only the consent has to be taken. And also, every doctor should follow the reasonable degree of care. At the same time, maintain competency in special areas. And also attend CMEs. That is very essential. Continuous medical education should be there. Further, document. If you don't document, it is not done. If you are done also, if you don't document, it is not done. Documentation and communications are very, very essential. If care is not documented, court assumes that you have not done it. Attend relevant continuous education courses like this. To conclude, my dear friends, the medical professions are entitled to get protection under the law so long as the doctor performs a reasonable degree of skill of care. To have a criminal negligence, it has to be gross negligence. For civil cases, it is the probability of the evidence which plays a role. And the doctor should act in the best interest principle of the patient. But however, the doctor's behavior, the way they communicate, that arrogancy, not spending time with the patient and family member will invite for medical negligence. So, my dear friends, keep communication open and learn communication skill to decrease medical negligence. Thank you very much for giving your valuable time. Stay safe.